অন্য কোনো নর্মা হয়েছে তোদের? হ্যাঁ, norma frontalis. Okay, so norma lateralis means lateral view of the skull. Okay, so first we will discuss what bones we will see in norma lateralis in this lateral view and how they are forming different joints or different fossas, different foramens they are forming, that we will discuss today. Okay, so see, this is norma lateralis. Here the mandible is articulated. Okay, so we will first discuss the bones. What are the bones forming this norma? এটা বন্ধ করে দিব, এখানে অসুবিধা হয়। And structures attached, muscles and ligaments attach this surface. Attached at this surface we will discuss. Okay, so see here, what are the bones we will see? This is norma lateralis. This one is frontal bone. Okay, here is parietal bone, occipital bone, temporalis, greater wing of the sphenoid, lacrimal, zygomatic, maxilla, mandible. Okay, so these are the bones forming the norma lateralis. And see the sutures here. This suture between the frontal and parietal, this suture is known as coronal suture, and the suture between the parietal and occipital, this is lambdoid suture. And the suture between the parietal and squamous part of the temporal, this is known as squamous suture or temporoparietal suture. Okay, and this area where four bones are joining and each separate suture is formed, this is known as parietal. Okay, here four bones are joining: anterior inferior angle of parietal, frontal, greater wing of sphenoid, and temporal. These are together forming the parietal. Parietal is also known as sphenoparietal suture. Next, here in this region, three bones are joining. Mastoid part of the temporal bone. This process is mastoid process. Okay. So mastoid part of the temporal bone, the posterior inferior angle of the parietal bone, and occipital bone, lateral angle of the occipital bone, they are joining to form this occipitomastoid suture or asterial. Okay, so these are the main features we are seeing here. And this arch is known as zygomatic arch, which is formed by joining of two structures. One is temporal process of zygomatic bone. This is zygomatic bone, and coming from backward is a zygomatic process of the temporal bone. Okay, these two are joining to form this arch. And here you can see this opening. This opening is known as external acoustic meatus. Okay, this is the external ear opening, and in front of this opening here is the temporal fossa. Temporal fossa, where the head of the mandible is articulating, and this is forming the temporomandibular joint. So this is mandible, it is forming part of the face, maxilla, and this part is mandible, forming the lower jaw, maxilla forming upper jaw, mandible forming the lower jaw. And this lacrimal is forming medial wall of the orbit, nasal bone is forming part of the nose. Okay, bridge of the nose maybe. And frontal bone is forming the forehead cushions, and there are two temporal lines are there. Okay, which is extending from temporal. These are the temporal lines, superior and inferior temporal lines. Okay, below the temporal line there is attachment of temporalis muscle, and this fossa is known as the temporal fossa. Okay, so this is one fossa of this view. Others are the, here will be the infratemporal fossa. Below the temporal fossa you will have the infratemporal fossa, and inside will be the pterygopalatine fossa. All those we will discuss. Okay, see here that the bones have been shown. Frontal bone, here is the greater wing of the sphenoid. This is parietal bone, temporal bone. Here is the suture has been shown, lambdoid suture, 5 is occipital bone, coronal suture, and 7 is the temporoparietal or squamous suture. So all those can be seen in your lateral view of the skull. This terian and asterian, these are very frequently asked in your viva. Which bones are articulating? Okay. In this terian, you can see anterior-inferior ankle of the parietal, this frontal, determining of sphenoid and temporal. And in asterian, 3 bones are articulating: posterior-inferior ankle of parietal, occipital, and mastoid part of the temporal. And see here the external acoustic meatus, this zygomatic arch. Just above the meatus, there is a triangle. Okay, this is known as suprameatal triangle. Deep to this triangle, mastoid air cells are lying. Okay, during surgery of the ear, cholesteatoma, there is some deposition in this pus collection or something in this mastoid air cell. Then you have to remove the bone at this region. You have to drill in this region to take out those infection or pus or like this. Okay, that's why it is important, suprameatal triangle. And here, this is supramastoid crest. And these are the lateral plate. Here we have removed the mandible. So this part is here will be the mandibular fossa. Here is lateral plate, lateral pterygoid plate. This part is forming the infratemporal fossa. And this elevation here, in this maxilla, this elevation is known as maxillary tuberosity. All those are included within the infratemporal fossa. And this is through this fissure between the lateral pterygoid plate and maxilla, if you enter inside, you will reach the pterygopalatine fossa. There is the nerve plexus of blood vessels are lying in this fossa, pterygopalatine fossa. And see the temporal lines. This is superior temporal line, inferior temporal line. Inferior temporal line, and below this surface is known as temporal fossa, and it gives attachment to the temporalis muscle. And the superior temporal line gives attachment to the fossa covering the temporalis muscle. Okay. So see here this real bone view. So this is terian, this is asterian, frontal temporal lines have been shown here. 3 is the zygomatic arch, 6 is external acoustic meatus, 5 is supramastoid crest here. This is mastoid process and suprameatal triangle above the external acoustic meatus in this region. Mainly terian, asterian. Here is terian in front, asterian behind. Here is the zygomatic arch and external acoustic meatus. Here temporal lines have been shown, superior, inferior temporal lines. Here you can see the supramastoid crest. Okay, mastoid process and suprameatal triangle. The yellow portion is suprameatal triangle. Meatus means external acoustic meatus here. Okay. So this we have discussed. So now see the muscle attachment in this surface. Okay. So here this is attachment of the temporalis muscle in the temporal fossa. Here along the zygomatic arch, upper margin of zygomatic arch, there will be attachment of temporal fossa. Temporal fossa will cover the temporalis muscle. Below it attaches over this zygomatic arch. Above attaches over the superior temporal line. So this is one attachment. Next here over the mastoid process extending into the occipital bone. This is attachment of 3 muscles from above downward. Here is attachment of sternocleidomastoid. There is below it is the splenius capitis, and below this will be the longissimus capitis. So 3 muscles are attached here. Now you see this is attachment of temporalis muscle. Temporalis muscle over the Coronoid process of the mandible we have discussed during the mandible. Temporalis muscle is attached over here, and here is the attachment of masseter on the lateral surface of ramus of the mandible. Here is attachment of the buccinator over the posterior part of the oblique line on the external surface, and here is platysma along the lower margin or base of the mandible. And here is also buccinator. Buccinator has upper fibers, lower fibers, and middle fibers are crisscrossing with each other posterior to this third molar. One raphe, pterygomandibular raphe over it, the middle fibers are attached. So these are the main muscles in this view. So see here is temporal fossa. Here is attachment of the temporalis muscle. Okay. Here is attachment of the lateral pterygoid muscle. Here is medial pterygoid. There is the buccinator, upper fibers of buccinator over the maxilla. Okay. Fourth is the sternocleidomastoid over the mastoid process. 5 is lateral temporomandibular ligament. Here, lateral temporomandibular ligament, one of the ligament of the temporomandibular joint. Okay, formed by the thickening of the capsule mainly. And 6 is the temporalis. Okay, so here is the very real view attachment of muscles. So the bones involved in norma lateralis is these bones. We have seen in previous picture temporal bone, parietal, occipital, frontal, zygomatic, maxilla, mandible, nasal, sphenoid, and lateral. All you have seen. So we are dividing the skull in norma lateralis in two portions. Cerebral portion, it is located above the zygomatic arch, and facial portion located below the zygomatic arch. So what will be the characteristic feature of the cerebral portion, that means above the zygomatic arch? We see these features: two temporal lines, superior inferior temporal lines, supramastoid crest, temporal fossa, zygomaticotemporal foramen. This is a part of zygomatic bone. Zygomatic arch, infratemporal fossa, suprameatal triangle, pterium, and asterium. Okay. What is pterium? It is the thinnest part of the lateral wall of the skull, an important area because it overlies the anterior division of middle meningeal artery and vein. Okay, so if injury occurs, it will rupture this middle meningeal artery and vein, and it will cause extradural hemorrhage. That's why this area is important. Okay. Next is asterium. Asterium is point where the posterior-inferior angle of the parietal bone meet the occipital bone, and the mastoid part of the temporal bone is joining bone. Asterium is lying posteriorly, you have seen in the skull. So we have discussed the cerebral portions. Next we are going to the facial portion. Facial portion, you will see the zygomatic arch, articular tubercle, you will see the zygomatic arch, articular tubercle, external acoustic meatus, mandibular fossa, styloid process, mastoid temporal, mastoid process, mastoid foramen is there, and gonial. Others are the pterygomaxillary fissure. This is lateral plate of pterygoid, and this is maxilla. So in between two, there is the pterygomaxillary fissure. Through this fissure, this infratemporal fossa and pterygopalatine fossa is connected through this pterygomaxillary fossa. And pterygopalatine fossa is inside, deep to this pterygomaxillary fissure, and there is sphenopalatine foramen. Sphenopalatine foramen will be in the maxilla junction between the maxilla and sphenoid. That will inside, they are placed inside. So temporal bone, we are seeing all the parts, main three parts of the temporal bone. Squamous part is fan-like upper portion, Mastoid part is the projecting part. Mastoid process is there. Tympanic part where the temporomandibular joint is forming. Tympanic plate is there. And petrous part we have seen in the base of the skull, projecting inward. Petrous part. So these are the four parts of the temporal bone. And these are the three fossa we have seen: temporal fossa, infratemporal fossa, pterygopalatine fossa. So we will discuss the temporal fossa. Temporal fossa is a flat, fan-shaped depression on the lateral surface of the skull, and these are the bones involved: zygomatic bone, frontal bone, greater wing of sphenoid, temporal bone, and parietal bone. All these are forming temporal fossa. What are the boundaries? See, this is the boundaries of the temporal fossa. Superior boundary by the inferior temporal line. Anterior by the frontal process of the zygomatic bone. So this is the frontal process of the zygomatic bone. And medial boundary by the surface of the parietal bone, temporal bone, frontal bone, and greater wing of the sphenoid. All these are together forming the medial boundary. Okay. And lateral boundary by zygomatic arch. You see here zygomatic arch. Inferior boundary by infratemporal crest of the sphenoid bone. Here, the here mandible is articulated, but in non-articulated style, you see this. You see this infratemporal crest of the sphenoid bone. I will show you the bone. Next is posterior boundary by the inferior temporal line. So this is boundary of the temporal fossa. This is temporal fossa is important for your viva. Okay, and you can come short note, come as a short note, temporal fossa. Next, the contents of the temporal fossa is temporalis muscle is attached to its floor, and terrier. Terrier is a small circular area where the frontal, parietal, sphenoid, and temporal bones are close together. Next, we are going to infratemporal fossa. Infratemporal fissures are paired depression that is inferior to the anterior part of temporal fossa, and it is divided from the temporal fossa by the crest of the greater wing of the sphenoid. Okay, so below the crest of the sphenoid will be infratemporal fossa. So what are the boundaries? Superior boundary by greater wing of sphenoid, anterior maxillary tuberosity, medial boundary with lateral pterygoid plate, lateral boundary by mandibular ramus and zygomatic arch, inferior boundary, inferior and posterior no boundary. What will be the contents of infratemporal fossa? Mandibular division of trigeminal nerve contains pterygoid plexus and pterygoid muscles, maxillary artery and its branches, middle pharyngeal artery, inferior alveolar artery and posterior alveolar artery. All these are contents of the infratemporal fossa. Next, we go to pterygopalatine fossa. It is a cone-shaped depression deep into the infratemporal fossa. Through the pterygomaxillary fissure, you can enter into the pterygopalatine fossa. It is located between the pterygoid process and the maxillary tuberosity near the apex of the orbit. You can even see in the bone where it is located. See, this is the pterygomaxillary fissure lying between the pterygoid plate and the maxilla. So through this pterygomaxillary fissure, you are able to enter into the pterygopalatine fossa. And see, this is outer opening of the orbit. It is cone-shaped, so it is lying near the apex of the orbit, pterygopalatine fossa. So what are the boundaries of the pterygopalatine fossa? Superior boundary by inferior surface of body of the sphenoid. Anterior boundary by maxillary tuberosity. Maxilla is like, so maxillary tuberosity is the elevation there. And medial boundary by vertical plate of the palatine bone. Lateral boundary by pterygomaxillary fissure. Inferior boundary by pterygopalatine canal. And posterior boundary by pterygoid process of the sphenoid bone. So these are the boundaries of the pterygopalatine fossa. What will be the contents? Maxillary artery and its branches, pterygopalatine ganglion, and maxillary nerve. So all these are content of the pterygopalatine fossa. Temporal fossa is also asked, contents may be asked. Okay. Next we go to temporomandibular joint. This comes in a long question. Temporomandibular joint. Its movements, muscles involved, what are the structures, bones involved, ligaments, all those will be asked. Okay. What type of joint? Temporomandibular joint. So temporomandibular joint is a complex articulation of the movable mandible and base of the skull. Complex joint because articular cartilage is there. You have read knee joint also have meniscus, which are cartilages dividing the joint cavity into compartments. Here also same thing is happening. One articular disc is present and dividing the joint cavity into two portions. So that's why it is also a complex joint. Okay, temporomandibular joint is complex type of synovial joint. Okay, understood? So it is a complex articulation of movable mandible and base of the skull. Articulation takes place in two areas between maxillary and mandibular teeth, interjaw dental occlusion, and between the mandibular condyle and temporal bone. This portion we will discuss later. Okay, between mandibular condyle and temporal bones. So bones involved in temporomandibular joint is condylar process or condyle of the mandible and mandibular fossa. And articular eminence of temporal bone are also involved. These two are main involving bones. Okay, condylar process of mandible and mandibular fossa. What are the components of the temporomandibular joint? Articular or fibrous capsule and temporomandibular ligament or lateral ligament of temporomandibular joint. Articular disc, joint cavities. So we will discuss these four topics in details now. Okay. First, the articular or fibrous capsule. This capsule encloses the joint surfaces like a sleeve and that runs from temporal bone superiorly to the condyle of the mandible inferiorly. The enclosed space between the articular surfaces is the joint cavity. Superior attachment of capsule are surrounding the mandibular fossa and articular eminence of the temporal bone, and inferior attachment is attached over the periphery of the mandibular condyle. Next we go to temporomandibular ligament or lateral ligament of the temporomandibular joint. It is a lateral thickening of the joint capsule and it is similar to the collateral ligaments of other joints. Medial lateral collateral ligament you have seen in ankle joint, in elbow joint, all those you have seen. So like this lateral ligament of temporomandibular joint. It prevents posterior and inferior displacement of the condyle but allows limited anterior movement of the condyle. Okay. Next we go to the articular disc. It is also an important component of this joint, articular disc. It is composed of dense fibrous tissues and lies within the joint capsule, intervening between the condyle and mandibular fossa. And it is a biconcave disc and that serves to provide reciprocal articular surfaces between its inferior surface and the condyle and its superior surface and the mandibular fossa and eminence. Okay, so it is biconcave disc. Three zones of the articular disc. Posterior thickening sits at the top of the condyle and fills the mandibular fossa above when the mandible is at rest. See here, this is temporomandibular joint. Okay, this is condyle of the mandible. This is articular disc and this is the mandibular fossa of the temporal bone. So see, this is the disc, articular disc dividing the joint cavity into two parts, upper part and lower part, and it is mainly by concave in shape. Here it is looking like concave convex in the lateral view, but actually it is by concave in shape to accommodate the elevation in the mandibular fossa also. One elevation is there. And three parts we are discussing. Posterior thickening sits at the top of the condyle. Here is the posterior thickening and feeds the mandibular mandibular fossa above when the mandible is at rest. Next is anterior thickening. It lies just below the posterior sloping of the articular eminence. Here is the articular eminence. Okay. So here is the anterior thickening. Next is intermediate zone. It lies between the two previous thickenings. Okay. Next we go to joint cavities. The disc effectively divides the joint cavity into two distinct upper and lower compartments, and that allow two types of joint movements. And these cavities are also filled with synovial fluid, which nourishes the articular disc. So we will discuss two joint cavities are there, and other accessory ligaments we will discuss. So one is two accessory ligaments span the joint but do not significantly limit the mandibular movement. One important ligament is lateral temporomandibular ligament, that is main ligament, and these are helping accessory ligaments. One is sphenomandibular ligament, runs from the spine of the sphenoid to the lingula of the mandible. Other is stylomandibular ligament. It runs from the styloid process of temporal bone to the angle of the mandible. Okay. Next we go to the synovial membrane. Synovial membrane, a layer of synovium lines the inner aspect of the joint capsule. This relatively dense membrane does not line the actual articular surfaces of the joints because synovial joints are generally weight-bearing joints. And the pressure in the temporomandibular joint is provided by the occluded maxillary and mandibular teeth. Synovium secretes the synovial fluids for lubrication and nourishment of the opposite articular surfaces. Two layers of the synovial membrane and intimal or cellular layer contains type A cells, which are phagocytic, and type B cells, which synthesize the hyaluronate found in the synovial fluid. Hyaluronic acid or hyaluronate component of the synovial fluid. Next is the vascular subintimal layer, which contains the blood vessels and lymphatics within the loose connective tissue matrix. Next we go to nerve supply of the temporomandibular joint. See here branches of the auriculotemporal nerve, branches of the mesenteric nerve. Mesenteric nerve passes through the mandibular notch in between the condyle and coronal process. So this is mesenteric nerve. Okay, and auriculotemporal nerve is related to lateral surface of the neck of the mandible. So these two are giving main branches. So branches of temporal nerve, branches of auriculotemporal nerve, and branches of the mesenteric nerve. All these are supplying this joint, temporomandibular joint. And this ligament you can see, this is lateral ligament of the temporomandibular joint. So we have discussed the nerves. Next we are going to blood vessels. Superficial temporal artery and muscular branches of the maxillary artery. Okay. Next we are going to the action of this joint and muscles involved in these actions. Mains are these muscles of mastication is attached over here. Main movement is, it helps in mastication. So during mastication there is forward-backward movement. Forward movement is protrusion and backward movement is retraction. Okay, and then there will be side-to-side movements. Okay, so these movements are permitted at this joint. So these movements are mainly helped by these muscles of mastication. Those are the masseter, temporalis, lateral pterygoid, and medial pterygoid. 4 muscles of mastication. Very frequently asked in your viva can be given in your theory. Okay, muscle of mastication. So protrusions. Protrusion means forward deviation of the mandible. So it is done by the lateral pterygoid and medial pterygoid muscle. Retraction, backward deviation. It is done by mainly the temporalis muscle, and these muscles are synergist. That means these are helping in retraction. Masseter, digastric, geniohyoid. Next is elevation. Elevation is upward displacement. It is done by temporalis, masseter, and medial pterygoid. These three are helps in elevation. Next is depression. Depression is done by lateral pterygoid. Okay. And these are the synergist muscle, digastric, geniohyoid, mylohyoid. Okay. Next is lateral movements. So there is forward backward movement, up down movement, and lateral movements. Lateral movements is done by medial pterygoid and lateral pterygoid. One side medial pterygoid is active, other side lateral pterygoid is active. Like this, movements overlap, lateral movements. Okay, that's all. So for temporomandibular joint, you read long question. Okay, and others you important for your bilateral bones fiber. See? And use fossa, temporal fossa, infratemporal fossa, pterygopalatine fossa. Those three you can prepare as short note. Those three are asked to use short note. Okay.
Norma lateralis, okay, lateral view of the skull. So in norma lateralis, you see this arch is the zygomatic arch, and this is external acoustic hiatus. This is the external acoustic hiatus, and this process is the mastoid process, and this is the temporal fossa where mandible will articulate. Just in front of the external acoustic hiatus, this fossa is the mandibular fossa where the mandible is articulated like this, forming the temporomandibular joint. Okay. So see the bones present in this lateral view. Anterior one, this one is frontal bone. Here is the parietal bone. This is temporal bone. Here is zygomatic bone. This is maxilla. And this is greater wing of the sphenoid, and this is pterygoid plates of the sphenoid.